Hello, my name is Sian and I'm a neurodevelopmental nurse specialist at Autism Oxford UK, and this month is Cervical Cancer Awareness Month. So what better time to talk about the cervical screening programme. Now here in the UK, if you have a cervix and you are aged between 25 and 65, you will be invited for a cervical screening, otherwise known as a smear test. And so I thought I'd tell you a bit about what to expect at your appointment today. So you will go to your GP surgery and you will be seen by a nurse for your appointment. Now you don't have to go alone, you can bring somebody for support or you can request a chaperone as well. So once you get into the nurse's room, you'll be asked to undress from the waist down, and this will be done behind a curtain, and you'll be given a sheet to pop over your thighs as well. So one thing that I like to do at my appointments, because I don't really like the feeling of the sheet on my thighs, is I will wear a dress or a skirt so I can use this instead of the sheet. And it means I'm only taking off one item of clothing rather than lots of bits of clothing. So once you're laid down on the bed, if you are not comfy in the position that you are in, you can request to change position. So this might be rolling on your side with your knees up to your chest. The nurse will bring down a light so she can get a better view of your vagina to have a look at any kind of changes to the labial skin or anything they can visualise from the outside. Now your cervix, for those of you who aren't sure, is at the top of your vagina, so it is the small opening that leads to your womb. And what they will use to have a look at your cervix is this, and this is a speculum. Now this is a size small. For reference, it's a similar size to my finger. You can request different size speculums if you feel uncomfortable during the test, and you can also stop at any point. Please do not feel you have to push yourself through it if you're really uncomfortable. It might just mean doing some reasonable adjustments and coming back on another day. So they will pop this inside your vagina and they will open it up slightly so they can get a good view of your cervix. Next, they will take a sample of cells using something called a cell brush, and I have one of these here. So it's really soft. I know that there are bristles, but I promise it's not spiky. It's very, very bendy and soft. They will put this into your vagina. They'll turn it a few times to take a sample of cells, take it out, close up the speculum and take that out. After this is done, which shouldn't take any longer than 5 minutes, mine are usually around 3, so this is kind of an average figure. It might be shorter and it's very unlikely to be longer. Once they've removed this, the nurse will step around the side of the curtain and they will tell you to pop your clothes back on. You might get a little bit of bleeding after your examination. This is very normal. If you are concerned, please go and see your GP afterwards and they will be happy to answer any questions that you have as well. Results will usually come between 2 and 6 weeks, and they will let you know, one, if you are HPV positive, so positive for the human papilloma virus, which is a group of viruses that cause cervical cancer. The test results will not tell you if you have cancer, because that's not what it's a test for, but they will, if your screening shows positive for HPV, test further to see if you have any changes to your cells. If you do, you will get a referral to a department called colposcopy for some further testing. You might also be asked to come back for a smear in a year's time if you are HPV positive with no cells changes or very early stage cell changes. So please go and book your smear, even if you've had your cervical cancer jab, because this doesn't protect against all types of HPV, because it could literally save your life.